Mrs. Scroggins. How are you?
I'm fine. How are you?
Good. I'm Mindy with Respiratory. So you're going to be taking your grandfather home. So we're going to start the process today, teaching you how to suction his trach. Okay? You'll get lots of practice before you go home. So this is just kind of the first step in the process. 2 therapists will come in after me. One will actually teach you the process and have you practice. We have a doll here that we're going to have you practice on before you practice on your grandfather.
Okay.
And then David's just going to kind of come in and follow up with you, do a little post test, go over some hazards with you, that kind of thing. Okay? So, first of all, our indications for suctioning is if you see your grandfather coughing a lot or you see secretions coming out of the trach, that's an indication to suction. If he's hooked up to the pulse ox and you see his oxygen saturation dropping, that's another indication to suction. Thick secretions, you want to make sure you suction them out. So if you think his secretions are getting thick, suction. And also a lot of times, like if you give him nebulizer treatments at home, after that they're going to cough a lot, produce a lot of secretions. That's a good time to suction. And first thing in the morning, because when we sleep, our secretions kind of settle, and then when we get up moving around, it causes a lot of coughing, the secretions get moving around, and that's also another time you'll probably want and or need to suction. Okay?
So you had said if I feel he's given secretions build up, will I be able to tell that? Like, will he cough more, gag, or what do I need to look for?
He will cough. That's a very good question. He will cough more. You may hear him gagging. He may sound. Sometimes they'll have like a sound.
Okay.
You'll be able to just kind of hear that it's kind of right here in his throat, but he
Okay.
can't quite get it out.
Okay.
Okay? That was a really good question. So here's our steps. First, you're going to assemble your equipment. So you'll want to get a suction catheter, which we have here. Since you'll be at home, the home care will bring you out a suction machine. They'll set the pressure for you. You never want to mess with that knob.
Okay.
Okay?
Okay.
If you have a problem that it doesn't have pressure or whatever, you'll need to call your home care company. So after you get your suction catheter gloves, you want to make sure that your suction machine is working and has power. So just flip it on. Make sure it's working.
Okay.
Your home suction machine should remain plugged into your power source at all times, so that battery is constantly charged.
Okay.
That way, if you have to go somewhere, you don't have to worry about your suction machine, the battery being low. Secondly, you want to wash or sanitize your hands with hand sanitizer. This is very, very important because hand washing is the best way to prevent infection.
Okay.
It's so easy. That's their airway. They get infected very easily, so I cannot stress hand washing enough.
Okay.
Next, you'll want to apply gloves. Again, even though your hands are clean and you've sanitized, gloves protect you and him. Next, and I apologize that we don't have quite everything we need, but you'll have a suction catheter, you'll have suction tubing, and you want to hook them together. Check for suction pressure. You have a place here. You'll apply your thumb right here to check for suction pressure, and you'll hear a noise. Then take your thumb off. Your grandfather should be wearing an HME or a trach collar. You want to remove that at that time. Advance the suction catheter down. Keep your thumb off until he coughs or until you meet resistance, like it feels like you can't go any further.
Okay.
Then apply your thumb to the suction and begin pulling the suction catheter out of the trach. Some people swirl it, some pull out. It's whatever's
But I
comfortable
put
for
my
you.
thumb over the.
Yes.
Okay.
And anesthesia will reinforce that.
Okay.
You want to get in and out in about 10 seconds, max 15.
Okay.
You're taking his air. If you need to, you can repeat the suctioning process up to 2 more times.
Okay.
Then you want to put his HME or his trach collar back on. Then you'll want to clean your suction tubing with saline or rinse water. A lot of homes, they just get like an old spaghetti jar or something, put water in it. Tap water's fine. Rinse your suction catheter. This cleans the mucus out of the suction catheter and out of the tubing. You'll probably have to reuse your suction catheter because home care company will only give you about 45 a month. So just clean it with an alcohol swab.
Okay.
and then put it back in your package. Then you'll want to dispose of your gloves and wash or sanitize your hands. Again, this prevents you from getting an infection.
Okay.
Okay, so that's kind of the process. Do you have any other questions?
Do I need to have any concerns as far as you said it remaining plugged in a power source? Do I need to have any concerns if the electricity goes off?
That's why I said make sure it's plugged into the power source at all times, so in the event of a power outage, you know that you've got battery. Usually the battery will last you 5 to 6 hours.
Okay, okay.
Okay?
Okay,
Again, a good question. So I'm gonna send Anastasia in to actually go over the procedure with you, show you, and then let you practice.
okay.
Okay? It was great to meet you. Good luck
You
at
too.
home. I think you'll
Thank
do
you.
a great job. And as always, just call us if you have any questions.
Okay,
Okay?
thank you. Come in.
Hi, Ms. Sproggins. I'm Anastasia. I'm
Hi.
from Respiratory. A colleague of mine was here earlier, and she went over the steps to suctioning, and
Yes.
I will just actually physically show you how to suction.
Okay,
All right, and I'm gonna let you practice after that. Okay?
okay,
All right. First thing you want to do is sanitize your hand. You can also wash your hand if you want. All right. And then you always want to make sure you have gloves on because we don't want Grandpa to get an infection.
okay.
All right. Now that you're gonna grab your suction catheter, and like my colleague mentioned, Mindy, this is gonna be connected to an actual vacuum. That's where you get your pressure from.
Okay.
Okay. And once you have your suction ready, you're gonna take Grandpa's tray collar if he has a tray collar on, or if he has an HME, whatever he has on. And then you're gonna take your catheter and you're gonna advance it into his trach. You're gonna go down until Grandpa coughs or until you meet resistance where you feel like you cannot go any further. And
Okay.
then you have your hand on here,
Okay,
and then you, just as you're taking it out, you put pressure on that so you can take the secretions out. Because if you don't put it on there, there's no pressure. So
okay.
basically, the pressure that's what's bringing out the secretion.
Oh, okay.
So basically, you go in, make sure you don't have your hand on there, because like you mentioned, you're sucking out his air. So you go in, feel like you meet resistance, put your hand on there, and just advance out slowly. Okay?
Okay.
And after that, you can go 2 or 3 times, no more than 3 times.
Okay.
So once you go twice, that's okay. If you feel like Grandpa still has a lot of secretions in there, and you feel like you want to go one more time, you're okay to do it. But I wouldn't do more than 3 times. Okay.
Okay.
All right.
Now, I need to keep this completely covered until I pull it completely out?
Right. You don't have to have your hand on here. So when you're going in, you want to make sure your hand's not on there.
Right.
Because like I mentioned, you're sucking
Right.
Grandpa's air. You go in, you meet resistance, then you put your hand on there, and then you pull out gently.
Do I keep my thumb on here
You
until
can-
I completely pull
You
out?
can put your
Okay.
thumb on there, or sometimes you can like intermittently put your hand on there while you're doing that.
Okay.
Whatever works better for you. People
Okay.
people suction differently. So
Okay.
whatever you feel like works better for you, you can go ahead and do that.
Okay.
All right. Do you have any other questions?
Nope.
All
I
right.
think
I'm
I
gonna-
got it.
Okay. To make sure you got it, I'm gonna have you show me exactly what I just did. Okay.
Okay, and I'm going to
All
use
right.
this other
Uh-huh.
packet?
That's the other packet. You have your gloves and you have your suction catheter,
Okay.
and I'll just wash you through that.
Okay. I'm short of gloves, does that matter? You want me to get her one the purple?
We can use this. It's a good thing we have extra gloves.
Yes. So I should keep extra gloves near too, right?
Exactly.
When I
Make
get
sure you
him
have
home?
extra.
Okay, and then I'm gonna pretend that I'm gonna remove the,
Mhm.
what did you call it, H?
It could be an HME, or it could be just a regular tray collar.
Okay.
Whatever Grandpa has one.
Okay,
Okay.
Okay.
Now you wanna go ahead and pull it out. And in as much as you don't wanna hurt grandpa, you also wanna be, fast, not too fast, but a little fast, so you're not keeping that, suction catheter in there for a long time, okay?
Okay.
All right, I'm gonna have you do it one more time.
Okay.
So you go ahead and put your suction catheter in there. Grandpa's coughing, now we'll give me resistance, now we're trying to suction him, pull it out. All right, go ahead and pull it out. Okay, good job. And after that, you wanna make sure if grandpa has an HME, don't forget to put it back on. If grandpa has a trach collar, don't forget to put it back on.
Okay.
And if you feel like there's secretions or anything, you can just take a cloth and just wipe it off to make sure grandpa is clean and everything. And also after that, you dispose your gloves and again, wash your hands. You can either wash your hands or you could sanitize your hands, okay?
Okay, now I have a question. You had said I could do this up to 3 times.
Right.
So when I have this in,
Mm-hmm.
can I go like in or out, or is it better to pull completely out and then put it in again if I
Right.
feel,
You wanna pull completely out.
okay,
Right, you wanna pull completely out. And then
Cover
give-
this.
Yeah.
okay,
Pull completely out, give grandpa a couple, like a second or two.
to
just-
see,
Yeah, to just
okay.
let him catch his breath, and then you can go again. And while you're doing this, I'm pretty sure grandpa will have like some kind of pulse ox on him. You could also look at his oxygen, because sometimes just make sure that his oxygen is above 90, okay?
Okay.
So that's why whenever you're suctioning him too, and you feel like, oh, I wanna give him a couple of seconds, you can put his straight collar back, so he can get his oxygen, and when you're ready to go again, you can go ahead and take it off, and go up, down, and take your catheter out, okay?
So the more I do this, the more comfortable I will get in.
Right,
Okay,
right.
okay.
It's a process, it's a process.
Okay.
And, yeah, the more you do it, the more practice you have, plus you're gonna have a lot of practices with this, and then you'll be more comfortable.
But as long as I go with the resistance or him coughing,
Right,
I'm not gonna hurt him.
right, yeah,
Okay.
yeah, perfect. Do you have any other
Okay.
questions?
No, I think that's all.
All right, and whenever you
Kind of
go-
makes me nervous
Oh,
to
no,
bring him
no,
home and
no, it's okay.
know that
I
I'm in
understand.
charge, but.
I totally understand,
Okay.
okay? But if at any point you have questions, you just make sure to call your home therapist to assist you with whatever you need, okay?
Okay,
Alrighty.
but I'm not gonna hurt him.
No,
Okay.
no, Grandpa
Okay,
will be
that
fine.
helps put me at ease.
Grandpa will be fine.
Okay,
Okay, I'm gonna clean up my mess here, and, a colleague of mine will be coming in to see you, and he's just gonna go over a couple of questions with you. Just make sure that, you have a good understanding of everything, okay?
okay,
Alrighty, thank
Okay.
you very much for your time,
Okay.
appreciate it.
thank you, I appreciate it,
Alright, you have a good one.
thank you.
Knock knock.
Come in.
Hello, I'm David from Respiratory.
Nice
I
to
know
meet
a
you.
couple of my colleagues came in earlier to talk about the trach
Yes.
care. I just have a little quiz, and I'm just going to go over the hazards with you on this, though,
Okay.
just to kind of reinforce. So the first thing we'll talk about is how they've been telling you to doing all the suction and everything. The main thing you want to make sure is when you're going through the suctioning is to make sure they get their oxygen level back up. You don't
Okay.
want it suction and then go right suction back again. You want to just make sure they get a little bit of period to get some air back in
Okay.
and reoxygenate. The second is if you're suctioning and you normally go down at a certain mark and you're not getting down that deep this time, don't force it, just suction from there and just pull out and keep going. You just don't want to force it.
Okay,
You don't want to hit something. And then the third would be, you might see a little bit of bleeding and you don't want to, and that would be caused because of the jamming. If you feel the resistance, you
Okay.
don't want to force it because you don't want to start some bleeding.
okay.
You have any questions on those hazards, or they sound
If I
pretty?
do have a little bit of blood, am I gonna, do I need, not that I'd panic, but do
No,
I need
it's
to be
more if if
concerned?
you're getting a lot of blood, then yes, just a little bit. You might just irritated,
Okay.
but that could be normal. That's not a big deal. If they freshly changed the trach recently,
Okay.
you might get a little bit just irritation, but as long as he's not bleeding immensely, I would not worry about it.
But the more I do this, the more I will really get the grasp of feeling
Get the grasp,
resist-
but you'll
okay.
get the resistance. I mean, the
Okay.
first couple times, it might take a little bit. I mean, it's probably best to just kind of gauge where you're going and kind of stop them where they cough.
Okay.
Because there's lines on the tube, you can kind of get an idea, and just, if you notice it stopping beforehand, don't force it. There might be a plug there and just
Okay.
suction that way, so that's the main thing. You don't want to try and force it down,
Okay,
because something could be in the way and that's going to cause more trauma.
okay,
Okay, and so we have a little quiz I'm gonna have you take. It's just 5 questions to just see if you understood what we're trying to teach you today and make sure you have a good understanding before we
Okay.
send you out there and you're on your own. So question number 1 I want you to answer for me. Does the family member need to wash their hands with soap and water before suctioning grandpa?
true,
Okay, perfect. Question number 2, does the family member keep on inserting the suction catheter even though they hit resistance?
False.
Correct. Question number 3, should clean gloves be worn when suctioning?
Yes,
Okay.
true.
Question number 4, is the primary indication for suctioning the patient cared at
Indication for suctioning.
their inability to clear by
Yes.
coughing? Correct.
True.
And then number 5, is bleeding from the airway a hazard of suctioning? Immense bleeding, I'm sorry, it should probably make a little more sense.
Is it
Like,
what?
Is immense bleeding from the airway a hazard of suctioning? If you're causing a lot of bleeding.
Okay. I'm not sure I'm gathering that one straight. Is the bleeding from the airway a hazard of suctioning?
Yes,
It
if you're
can
getting a
be,
lot,
yes.
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 If you're getting a lot of bleeding, that would be a hazard, because it's the
Okay.
trauma, like we were talking about when you're
Okay,
suctioning
then I
down.
would be going down too far.
You would be causing
Okay.
trauma, or you're hitting something when it's still going down,
Okay,
so
see,
yes.
that one makes me a little leery, but,
Mhm.
but I'm glad you explained that.
No,
Okay.
that's why we do the quiz,
Okay.
just to make sure you got a good understanding.
Okay.
Okay, is
All
there
right.
any other things that you're not too sure, any other problems you're
No,
worried about?
I think you guys have been great.
Okay, all
I
right,
guess it's all up to me now.
well, good
Because
luck.
I've had good instruction.
All right, well, good luck, we're always here if you need anything, you can always
Okay.
call the hospital or call your RT and
Okay.
we'll walk you through it then, okay?
Okay,
All right,
thank you,
thank you.
David. I appreciate it.